Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Today, we'll be speaking with Joe Cohen about biohacking and DNA testing. Joe Cohen is a successful biohacker and entrepreneur, the founder and CEO of SelfHacked, lab test analyzer, and SelfDecode, a DNA analyzer and precision health tool that utilizes AI-driven polygenic risk scoring to produce health recommendations. His favorite biohacks include lectin avoidance diet, the sun, blocking light at night, circadian rhythm entrainment, pregnenolone, microdosing THC, butyrate, curcumin, galantamine, and nicotine. Joe, thank you so much for joining us today.
Hi, thanks for having me.
So what inspired you to start these companies, SelfHacked, Lab Test Analyzer, SelfDecode?
So I had a lot of my own health issues growing up. I had just a whole bunch of different kinds of health issues. I counted 75 when you include all the minor different things going on.
So why don't you tell us about some of those health issues?
Yeah, I've got a whole list of them I published on online. But basically, it's like, mental health, anxiety, brain fog, energy issues, inflammation, then just like random stuff like acne or, things like that. But, when you count it all up, it equaled insomnia, sleep issues, all the routine stuff, plus, a bunch of other stuff.
So how did you manage to deal with these?
So I first got into researching the body from top down, first principles, the nuts and bolts. And that's eventually how I got into DNA, because I realized, hey, this is the fundamental biochemistry, and this tells us all the nuts and bolts. And, with one test, you could really figure out tons of information. So I would say you
started out by going to conventional doctors for some of these complaints?
I did. Yeah. None of them were able to help me at all. I went to the alternative ones as well, and I didn't really connect with them too much either. It just seemed like they were using, I don't know, stuff either that I didn't believe in, or stuff that was just, it seemed random, or that just didn't work, right? So it seemed hit or miss, to be honest. And so I knew the future was precision health, right? We got to know first, and that starts with data. So first we have to know what's going on in the body. And how do we know what's going on in the body? Well, we know there's genetics and blood testing, right? Lab tests, different kinds of lab tests. Genetics, I think, is in a league of its own, but pretty much you got genetics and then you got blood tests. And I've been doing these
stool tests and urine tests and a lot of other tests.
Sure.
To look at different biomarkers of what's going on.
Right. Lab testing in general to see what's going on in the body. That's like, that could change from day to day. And then you have the genetics, which is pretty stable, but then that's where you can learn your predispositions, all the nuts and bolts of how things are wired, right? And then you could actually see how things are ticking in reality. But I think you want to know both of those things, right? So you want all that data of how you're wired, then plus what are the nuts and bolts in reality. The reason why it's useful to know how you're wired is because let's say you have a genetic predisposition for a condition that you have, then the fact that you have it is there's probably not that many lifestyle factors, or the lifestyle factors are not as significant as it would be if you did not have a genetic risk and you had something, right? And I've seen this time and again where the things that I have a genetic predisposition for, they were harder to take care of. But actually they required more therapies, like a much more comprehensive approach, because when we do genetic analysis at SelfDecode, we're looking at millions of variants often. So it's kind of looking at a whole picture of pathways and whatnot on how how your body is wired. And if you're wired for a specific condition, and then you end up having that condition, usually it's more than one mechanism. It's quite a few mechanisms by which it's happening. And then just doing one lifestyle approach is usually not going to solve it. You would have to combine it with lifestyle, supplements, diet, like more of a comprehensive approach.
Okay. So where do we want to start diving into the DNA testing? Is that what you want to focus on today?
Well, we could. We could just go. We could go through my process about how do I go about solving all these issues, right? Because I had 75 different health issues, and I think the future of how to solve your health is really through a combination of stuff. So I think there's a few big ways that you can try to figure out what you need to do, right? I think that's the biggest question people have is what supplement should I take, or what should I do? What's going to work for me, right?
Sure.
And traditionally, you go to a doctor, they look at one symptom, maybe two, and they're going to say you have anxiety. Here's a supplement for anxiety, right? That's kind of how it works. And
that's not how functional medicine practitioners work, but maybe
not functional medicine.
Doctors.
I'm talking about the conventional doctor.
Okay.
I would say
they're going to prescribe a drug.
You have anxiety, so then we're going to give you an SSRI. It's kind of like, okay, there's a couple options. That doesn't work. There's, it's pretty much a template of how that works.
Sure. Right? A lot of conventional medicine really ends up treating symptoms rather than the underlying cause of the condition.
Yeah. Now, when we get into functional medicine, I think you're right. They're trying to take a broader view, and they're not saying you have this condition, therefore.
And we're trying to get to some of the underlying causes and not just treat the symptom.
Correct. Exactly. So that's the goal of functional medicine, is to try to get to the
there's good functional medicine, and then there's not so good functional medicine. And it's easy, actually, for functional medicine, if they don't really want to do the hard work, to just fall into sort of a green version of conventional medicine, which is you have this symptom, don't take this drug, take this supplement that will do the same thing.
Absolutely. So I agree with you. I think there's a lot of people in functional medicine that operate that way. Hey, I know this supplement for this condition. They're just working with supplements and lifestyle instead of drugs. But the concept wouldn't be too different with those people in particular, right?
Right.
That's kind of what I was referring to when I said you go to a doctor. It's kind of like a typical doctor, even in functional medicine. A lot of typical doctors work that way. Now, I think that's moving in a different direction. And, but now even when we go to the doctors who don't work that way, then we have to ask, okay, so how are these other people working? A lot of them are trying to work based on a root cause, like you mentioned, but a root cause could either mean like a root environmental cause. So you go to the doctor and then they say, you have a mold issue. That's your root cause, right?
Okay.
Now, I have problems with a lot of those functional medicine practitioners as well, because what happens is that
you just have to know that that's kind of my orientation. So I'm probably going to give you some pushback on this, but go ahead.
Well, no. So hear me out a little bit.
Okay.
What your orientation is in, like, you're focused on mold?
No, but
okay. Oh, well, I'm not arguing against the general. You hear me out and the rest.
Okay.
The problem becomes when a practitioner focuses only on, meaning whoever comes in, they're going to say you have a mold problem.
Oh, okay.
Yeah. So not that clearly environmental factors like mold or infections or any environmental factor is going to play a very significant role. The problem is a lot of functional medicine I'm not saying you at all, right? But I'm just saying a lot of functional medicine is going to say, everyone who comes through the door has a mold problem, or everybody who comes through the door has a Lyme problem, and now we just have to find the right test to confirm it.
Right.
So that's what I'm saying. That's kind of, I'm breaking different types of functional medicine doctors into different categories. And what I'm saying is there's some clearly environmental variables. Clearly, a lot of people have mold issues, right, or environmental toxins.
Right, and there's got to be an interaction between genetics and the environment, because obviously you can put 10 people in a room with mold, and you might get 2 or 3 of them get horribly sick, a couple of them get mildly sick, and half of them don't feel anything.
Exactly. So the problem comes when, again, there's going to be people who just say that, like I said, they're going to focus on one of these environmental factors, and their whole business is based on that.
Right.
And so it's like you just come in the door, they just automatically tell you got adrenal fatigue, or you got mold, or you got this. And I'm not saying that. I'm saying each of these factors could play a role. The problem is that. First of all, often there are usually many things that are playing a role.
By the way, that's poorly done functional medicine.
I would agree with that. I'm not against functional medicine, just to be clear. I'm against poorly done functional medicine. Right. So I'm trying to go through the pourely done functional medicine.
Go ahead.
I'm going after the straw men here. Not Maybe I should steel man functional medicine a little bit, but I'm going after all the weak points, because I've encountered these myself, right? You say like, hey, you tried, you go to a regular doctor. This is exactly what's going to happen. They're going to you tell them you have anxiety, they give you an SSRI. There's no other questions asked, right?
Yeah.
If you go to a general practitioner, they'll send you to a psychiatrist. The psychiatrist will then give you an SSRI.
Right.
If that doesn't work, there's a second line treatment. It's just kind of, you're like cattle. And so then, but yeah, so, and then I would say with functional medicine, it seems like the type of functional medicine that you're doing is much more optimal, where you're looking at multiple factors. You don't identify everyone as the same that the same factor is causing all their health issues, right?
Definitely not. I mean, that's one of the important things about doing a deep dive into your health history, to get some of the, hints at what might be going on, what's different about your environment, exactly what's happening to you. And then, trying to do the right testing to confirm what we think might be going on. And sometimes it turns out to be something different.
So I think that's the good part of functional medicine, right? Like, you're taking the time to try to understand what's going on. You're trying to do more testing after you have a theory to either confirm or deny your hypothesis, right?
Exactly.
So I think that's the good functional medicine. You're part of the good crew. Now, what we're having though, I think there's a next level of functional medicine that is, and I'm not saying you're not using it. I'm just saying that this is where it's evolving, where you're using as much data as you can to make intelligent decisions, right? And so the types of data that you could use is, first of all, you have all different kinds of lab testing. There's so much different lab tests you could do. Like you said, stool, urine, a whole variety of blood tests, metabolomics, basic lab tests too, that doctors order, but that aren't analyzed properly, right?
Right.
And then you have genetics is its own space. And, I'm in the genetic space, so I have a lot to say about that. The way that genetics is done in functional medicine currently is a disaster, usually. And the reason is because the way it started. So it started by looking at individual variants. So in functional medicine, I mean, how much are you into genetics per se?
I use some genetics. Over the years, we've used certain specific genetic tests that we've added on. I've done taken the 23andMe or Ancestry and put it through some software to get some idea of how this might inform, and then you can also get a sense of some of the genetic background by looking at what's going on in the body. Right. So, for example, I just had a patient, we did micronutrient testing, and she has low vitamin A. How could she have low vitamin A? Well, she's taking a prenatal that contains that contains a precursor to vitamin A. So that tells me that in her case, she's not able to readily convert the precursor of vitamin A to vitamin A. So she's going to need to take vitamin A in a more direct form.
Right. So she's taking beta carotene, yes, and then it's not converting into retinol.
Right.
So yeah, there's the BCO gene that is involved in that.
Right.
Now, so I'd say that is, so the way that functional medicine works with genetics is looking at single variants, and sometimes that could be valid. I think in the specific use case that you used, it is valid, right? Where there's a few variants that are looking at the conversion of beta carotene to retinol,
right?
And you could use genetics to see that,
right?
And people also use MTHFR, and that could also tell you there's specific important variants that are related to converting synthetic folate to the more active folate,
right?
Folate. And so functional medicine uses that. Where it breaks down is when you use it to predict what somebody's predisposition for a very complex trait. So any disease, almost any disease, is a complex trait.
Sure.
What that means is that there's millions, often variants that are involved in that condition.
Right.
Let's say heart disease, you're going to have a million variants that are related to it because there's so many things going on in the body that are related to heart disease. The problem is a lot of these tests, they're going to try to tell you based on a couple SNPs that your risk of heart disease is higher or lower based on a couple SNPs. That's where the biggest problem is. So they kind of take that same kind of thinking of we're going to use a few SNPs to figure out if you have a good conversion of beta carotene to retinol, or a conversion of synthetic folate to methylfolate. They then transfer that logic to try to predict more complex traits, which you cannot do, unfortunately.
Right.
And so what's happened is the whole functional medicine space in genetics is using that concept where there's some validity to it, but they're making it more broad. And then so then a lot of these companies, it's very cheap to create a genetic company that looks at a couple SNPs and just has a PDF report. It's a few $1,000s to create a company. And what happens is these companies get created, they just spend all the money on educating practitioners and marketing on here's the SNPs that you need to look at, right?
Right.
And then it happens to be our test has all these SNPs.
Right.
Right. And so people get trained on like very specific variants, which again, when we looked at all these tests, we realized that it's not valid to predict any kind of complex trait. You could predict lactose intolerance. You could predict a couple other things. Maybe you could predict ApoE and BRCA with specific variants, but you cannot predict a complex trait. And so conditions in general, diseases, conditions, these are complex trait. Sometimes nutrients have less variants, but sometimes they have a lot of variants that are related to it. So I think the future of functional medicine is going to be looking at much more advanced software in genetics that is looking at millions of variants. And again, there's a reason why companies don't do it, because to build this infrastructure, first of all, we have 25 engineers just to maintain this stuff, right? Like,
right.
It's very complex. Whereas if we just built the initial version of what we had was basically what all these other companies have, just a PDF. It's very cheap. There's no server costs. We're paying like, $60,000 a month just in server costs. Whereas if we just had a PDF with like 50 SNPs, it would cost almost nothing, right? Because very little processing there.
So the difference between your genetic testing and, say, taking data from 23andMe and analyzing it is what?
I mean, it's huge. So I wouldn't say taking data from 23andMe per se. I would say, because 23andMe is, the data itself is okay. They're looking at, let's say, 700,000 variants.
Right.
What you still have to do after that, you have to put it through software that we built this software that it's called imputation that you can extract that. You can actually predict all of somebody's variants based on these 700,000 variants with the right software. The problem becomes when you do a test that it's only looking at 50 SNPs or something like that.
Oh, okay.
And so it's not the test itself, it's the analysis. But then a lot of these companies will only do the 50 SNPs that they're looking at because they don't see any need to do other ones. So you cannot reuse that data anywhere else.
Right.
The 23andMe's you could reuse. It's still better if you do it with us because when you don't get it directly from the lab, you're missing actually a lot of data. That text file that you have is just a fraction of what the data that comes off the lab is. They do it because you can easily download that data on your computer as a text file, and upload it. You can't handle a VCF file. You need specialized software for it. So the idea is that, and the other thing is, and the other thing is when you have too many different kinds of files, it becomes complex. Like we validated on our type of file, and then if you change it around, sometimes the results are not exactly the same. So the idea is that the 23andMe files are not so bad in and of itself. That isn't the issue. The issue is the analysis, right? And so I think number one is I think when you have good genetic analysis, I think you could, I think that could really make a very big difference with predicting what is somebody at risk for, and also predicting what kind of recommendations they need based on all their genetic risks and all their variants that they have. So that's one. And then I think you want to do a lot of biomarker testing, especially the ones that are applicable, to see what is, what's actually wrong in reality.
Right, to see which
that
genes
are related,
being expressed or not.
Yeah, or just, which lab tests that are related to specific issues that they have, right? You want to do those lab tests.
Sure.
Right? So if it's
you might have an increased
issue,
risk of hypertension, but you might not have hypertension, or you might have an increased risk of small dense LDL, and you might not have elevated small dense LDL.
Right, exactly. Exactly. So, it's actually interesting. Do you ever test ApoB in your practice?
Yeah, of course.
Okay. So I had a genetic risk of high ApoB.
Okay.
High lipoprotein A.
Okay.
But normal LDL cholesterol.
Okay.
Now, LDL cholesterol and ApoB are correlated.
Yes, they usually track with each other.
They usually track, right?
Yeah.
Now, the thing is that because my genetic risk was typical, my genetic risk for ApoB was high. It turns out that I can normalize my LDL cholesterol just by changing one lifestyle factor, is how much saturated fat I eat.
Okay.
It does not normalize my ApoB.
Okay.
Yeah. So if I want to normalize my LDL cholesterol, there's so many things I could bring it down with: drugs, diet, supplements. When I want to normalize my ApoB, it could go down, but it's way harder because I have a very high genetic risk for that.
Yeah, it's unusual. Most of the patients I've seen who have elevated ApoB, usually the things that would lower their LDL lower their ApoB because that's part of ApoB.
And that's true. And the things that lower one is going to lower the other. But when you look at the magnitude, my LDL cholesterol was at 250 at one point. And then it went down to 50. But my ApoB was 120 and went down to the 60 at the lowest.
Now what about your LDL particle number? Because I think that
the LDL
more
particle
closely
number,
with ApoB.
It does. That was also more difficult to go down.
Right.
More difficult than the LDL cholesterol.
Right, because LDL is an estimated number. It says you have this much LDL,
Right.
not how many particles you have. And the smaller, dense particles are the riskier ones that are more likely to create plaque.
Correct. Exactly. So, I mean, and then, was able to find that I had, number one is it did call my ApoB genetic risk correctly for sure. It's very clear that I have high ApoB and LDL particle count. And then it also called my lipoprotein A. And so genetics can really do a very vast screening of predispositions, whether you're going to heart disease, kidney disease, cancers. Cancers are more environmental, so it's not as accurate, but you still can get a very good screening of a whole bunch of conditions. And if you have something, you could also use it as a differential diagnosis to see, okay, how much is this genetic versus lifestyle? And I find that that's quite accurate in the sense that when something's more genetic, it usually requires more things. When it's lifestyle based, it's usually one thing that's causing it. That's when the mold things could be more like, oh, you got one infection that's just, okay, that, you got mold and you just take the mold away, then you shouldn't have a problem. That's theoretically, right? Like, because it's one environmental variable.
And it should also be able to help us decide which therapies are going to be more effective for you versus someone else.
Exactly. So that it also helps determine, based on specific variants, you could kind of upvote a little bit in terms of the recommendations. That's what we do with these specific variants. We will give it a little more weighting. Number one is that, so the issue with these other companies is that they're going to give a recommendation just based on the SNP. You cannot do that, because you first have to find all the things that are relevant for a condition, and then you can weight them up or down based on specific variants, right? Meaning, like, if you want to see, okay, you have this SNP for LDL or whatever, you're not going to say take this. First, you're going to see what are all the things that work for LDL. Okay, berberine could work for LDL cholesterol or ApoB. Do you have a specific SNP that berberine helps even more with, right? Then it might help even more. That's the idea. It's not... and then there's pharmacogenomics as well, which, if somebody's dealing with pharmaceuticals, they could see which pharmaceuticals are more likely to benefit them as well. So you see the concept of pharmacogenomics. It does translate into supplements. There is going to be specific variants that could make something more or less likely to work, but you're not going to be able to predict based on specific variants, because that is more like based on too much information. So that's where the newest genetic technologies have come, and that's what we mainly work on, plus the software to bring it all together so that it makes it easy for people to understand what they need to do, and then they can look that over with their doctor and things like that.
Right. So is your software, is your SelfDecode genetic program, is it designed for specifically for patients or practitioners, or is there a version for each?
Okay. Both. There's a version for each. Yeah. Actually, we're going to separate the practitioner one into a different brand. But essentially, yeah, it could be used for both, because the hard part about genetics is the more comprehensive the platform you have, the harder it is for the individual to understand what they need to look through, right?
And the harder it is even for a practitioner to integrate it into it, because I can recall using this other software for that one of the supplement companies set up to analyze DNA data. And in the midst of a, even long hour and a half consultation, and we're going through their history, and then to try to put into all this genetic data on top of it is and you're looking through pages and pages of data.
Yeah. So I can, if I share my screen visually, I can show how this is my approach. This is, we have a big science team, but I designed the kind of the recommendation engine to fit with my general approach. And I could show you how that looks if you'd like.
Sure.
So this is a recommendation engine, right?
Okay.
And let's say if we click on, is there any So is there anything here that particularly interests you? Would you like to?
I mean, all those. Why don't you look at fish oil?
Okay. This is going to tell me that all the things the fish oil helps me with. Okay.
Okay.
And so these are based on questionnaires. And so I've had symptoms, conditions, gut inflammation, and mood issues in the past. Okay. And so fish oil helps with both of these issues. And if you click on this, it'll show you all the references and exactly how. But the idea is that it's saying that fish oil is helping these specific issues for me, right? These are the goals that I have.
Okay.
That fish oil helps with, right? You can click on any one specifically if you're like, hey, how does fish oil help with that, right?
What do you got to say about fish oil and prostate cancer?
That's a good question. Let's see. Omega-3 fatty acids. So let's see. It possesses anti-inflammatory effects, and it works by reducing inflammation in prostate tissue. It helps regulate testosterone metabolism and inhibit the 5-alpha reductase enzyme that converts testosterone into DHT, which is associated with prostate cancer. Basically, yeah, and there's some studies showing like probably correlations with fish oil consumption and lower risk of prostate cancer.
Okay.
Yeah. So the idea is that, it's these like there might seem like it might seem like I have a lot of genetic risks here, but actually there's 1,300 reports and genetic risks essentially, and it's just taking the ones that I have high risk for.
Now, since you mentioned prostate cancer, when you start getting into summarizing data, scientific data, there's so many different reports and so much controversy. I wonder how you decide how to sort through that.
Well, it's sorted through an impact system and a science system based on 1 to 5.
Okay.
And in order to be a 1, it has to have some kind of clinical trial. It could be small, right, but it has to be a clinical trial.
Right.
Now,
like, for example, with prostate cancer, there was one study that gets repeated a lot where they looked at DHA and EPA levels and found that slight differences increase the risk of fatal prostate cancer. And you've still got doctors out there saying, don't take omega-3 if you have prostate cancer. Based on that one terrible study in which none of the participants were actually taking fish oil.
Exactly.
I've really been enjoying this discussion, but I just want to take a few minutes to tell you about a product that I'm very excited about. Imagine a device that can help you manage stress, improve your sleep, and boost your focus, all without any effort on your part. The Apollo wearable is designed to do just that. Created by neuroscientists and physicians, this innovative device uses gentle vibrations to activate your parasympathetic nervous system, helping you feel calmer, more focused, and better rested. Among the compelling reasons to use the Apollo wearable are that users experience a 40% reduction in stress and anxiety. Patients feel that they can sleep. Their sleep improves up to additional 30 minutes of sleep per night. It helps you to boost your focus and concentration. And it's scientifically backed. And the best part is you can get all these benefits with a special $40 discount by using the promo code Weitz, WEITZ, my last name, at checkout to enjoy these savings. So go to Apollo Neuro and use the promo code Weitz today. And now back to our discussion.
The thing is, let's say if it's an impact of 1, then sometimes it's just going to be wrong. There could be a clinical trial on something that's just wrong. It's not reproducible. The thing is that it could get drowned out by a lot of other data. Essentially, right. If you're assuming that most of the time it's going to be right, then overall the information is going to be correct. So these are my genetic risks, and then it's looking at my symptoms, conditions, and goals, and it also looks at my lab risks. So these are all the lab tests that were suboptimal in the past.
Okay.
These are the ones that are red are still suboptimal in the last lab results.
So you get your genetic data, you put in your labs, and then this correlates it.
Correct. Exactly. So the stuff that's higher up, fish oil is number 5 as it relates to supplements. It's higher up because if you notice, there's 23 genetic risks that it helps with. And that's out of, there's 69 things that I don't have a genetic risk that it helps for as well. But just the things that I have a genetic risk for, it helps with, 23 of them. And then I have 27 labs, 9 current, 18 past, that it's helping with. And part of the reasons why some of these are passed is because I'm also taking fish oil, right? So you could see, certain things that were just not optimal in the past are currently optimal. And it could be that fish oil help with making a lot of these optimal. And then there's lifestyle risks based on just questionnaires. This is what a doctor will look at when they're taking family histories, but it's just more intelligent system. So, basically the idea is you want to look at the symptoms and conditions, but not just one, as many as you can. You want to look at somebody's goals. You want to look at all their DNA risks. You want to look at all their lab risks, but not just one at a time, as many as you can. And you want to look at their lifestyle risks, as many as you can as well. And then sometimes you have you see this symbol, there's a specific genetic variant that can help even more with how, fish oil and migraines, for example.
Okay.
Right. So that's kind of, there could be a genetic variant attached to making something work a little better. But that's the idea of how I think, that's kind of my ideal of how I think functional medicine should work.
Sure.
Is, and then you also need an individual attached to it who understands supplements, who understands lifestyle, who understands how to use different softwares, who understands, what to make of the impact of each of these things. Like, okay, you don't freak out about this lab test. Don't worry about that. Like what to worry about, what to not. There's too many, there's too much data that kind of go in between the cracks that it's hard to, you can't just, you have to have somebody who really is knowledgeable, and I think that could help tremendously. But that's why I'm saying we also have a practitioner platform, because I think people are benefited when practitioners who are knowledgeable know what they're talking about, because there's a lot of questions that people have that's impossible for them to just understand. There's too many things going on, right?
Right. So
even filling out the symptoms and conditions, by the way, I have some clients. I find that they can't do that even properly. I'm like,
who are really bad at that is men. We have all the patients among the paperwork fill out this symptom questionnaire, and women will check off like 90 different things, and men will check off one thing. And then you start talking to them and they go, yeah, my gut sucks. I got this, I got that. And I go, you didn't fill any of that out. Wow.
Exactly. Actually, I have the same experience as far as I can tell. Is like the men are usually a lot worse than that. It's like, no, I don't have any issues. I just have this one issue here that I'm trying to fix. But then actually find out, I go through their DNA risks, all their predispositions. And I'm like, do you have this? I'm like, oh, you know what? Actually, I do have. And sometimes they don't even know. Like, I the other day, like this guy's like, yeah, my nose is stuffed, but I don't. I'm like, I think I asked him before. I'm like, do you have any allergies? He said no, because he had a genetic risk for it that he had allergies. I was like, he's like, no. I'm like, okay. He's like, and then it just came out later that his nose was always stuffed. I'm like, he's like, yeah, it's just like during pollen season and stuff like that. I'm like, yeah, those are allergies, by the way. He's like, oh. I'm like, yeah, let's add allergies in here. So. A lot of people don't even know what symptoms and conditions they have, and there's no software that you can do that's going to ever fix that, right? Like you have to talk to somebody, see what's going on,
right?
So what I'm saying is that there's
Oh, you mean the fact that I haven't taken a dump in 3 days means I have constipation?
Exactly. Exactly. It's the fact, the bottom line though, is that I think we're living in a very exciting age where you have AI and software that is able to do a lot, but it's similar to like software developers. You know, these diagrams where it shows like, you know, the demand for software developers is declining rapidly. But the people who are staying around, if you're a good software developer who could use these AI tools well, there's actually even more demand, right?
Okay.
So I think the same thing is going to go with doctors, especially with functional medicine. The people who are not very good, I think, are worthless. I mean, to say it very meanly, but like if somebody's not very good, just use software, maybe ChatGPT even, but if somebody's good, they could utilize tools and really understand things way better than, because ChatGPT is going to be wrong a lot of the times and whatnot. They're not going to understand the context or, the person's environment, or there's a lot of things, there's a lot of gaps that are missing. So, but what I think is that now with technology, I think the right practitioner who has an understanding, can really leverage things, new lab testing that we have, and to really have a much better result. Because the amount of lab testing that's out there, and I just see the genetic testing just as its own, huge changes are happening. But also just with any kind of lab test, you saw how many lab tests I had that I had done. Yep. And, you could sort them. Okay, these are not optimal. And by the way, the fish oil helps with 27 of these lab markers. Right. And again, now the question is, okay, which fish oil do you get and how much and when? And, you give somebody a fish oil, they say, okay, I got a little nauseous. Okay, then take less of it. Right. These are kind of where you need doctors to understand the patient.
And ideally, you need to not just test, but you need to retest. So you give somebody 2 grams of fish oil and their omega-3 level is still low. Well, then that's not the right amount for you.
Right. And by the way, I had an experience with that. I was taking 2 grams of high concentrated fish oil.
Right.
And my omega-3 levels were still low.
Right.
And what I realized from that experience, I was doing a lot of testing. So I was testing it a bunch of times. What I realized is every time my body was fighting an infection, it just took all the EPA. It just used up all the EPA. It turns out that EPA is needed when you have infections. And so I was doing these tests when I was traveling. So you go on a plane, you get an infection, right? Whether you feel it or not, you're going to get an infection, right? You're traveling around the world, you go to India, wherever, you're getting infections.
Right.
And then your body is just using up EPA like crazy.
Right.
And more than DHA, just EPA actually.
Right.
And what I realized, I started just taking like 5 grams of high concentrated fish oil a day. Finally, it was enough.
Right.
Right. Because you get one infection, it's just going to wipe out your EPA stores.
Right.
Or you get inflammation or something. And what I found is just, I think we need more fish oil now than ever before, because we used to live in like these small tribes where you interacted with like 20 people, and those people never used an airplane, right? They had a horse at a certain point, like in recent years, right? 5,000 years ago, I think the horses came out. Before that, you were just walking everywhere, right? So it's like you interacted with like 100 people in your whole lifetime.
Right.
Whereas now, just something could spread throughout the world and you get that infection. I mean, you could, if you're traveling a lot, you could be getting, 20 infections a year easily, right?
Sure. And we have a lot more bugs that are resistant to antibiotics, and, we're less likely to have immunity against them.
Absolutely. Yeah. And, these viruses are always evolving and whatnot.
Right.
But we're exposed to so much stuff that I think that, assuming, we're eating fish all day, even, we still might, it's still possible to be deficient in omega-3, right? And I think a lot of nutrients are like that. Actually, is that it's not. There is an RDA, but I think the RDA goes to shit whenever there's an increased need for any reason.
Yeah, the RDA is just based on a particular disease that occurs if you have below a certain amount.
Right. Exactly.
And we're not taking fish oil.
Well said.
We're not taking vitamin C to prevent scurvy. We're taking vitamin C because we want to scavenge some of these free radical reactions that would otherwise damage our tissues. So,
well, yeah. And now that you mentioned that, I also have another example there with vitamin C. So, allegedly, right? And it seems like if you're taking, you only need 60 milligrams of vitamin C a day, or maybe 90, right?
To prevent scurvy.
Right. So I said, I'm going to take 2 grams of vitamin C a day.
Yeah.
And I was taking it in the form of slow release and throughout the day.
Okay.
So I was getting a steady dosage of vitamin C.
Yeah.
And the reason was because, over 2 grams, you increase your risk for kidney stones. And,
arguably.
Yeah, sure. But that's kind of where I was coming from. And then I kept on taking these tests for serum vitamin C because there's studies about serum vitamin C and health outcomes. I kept on having low levels. I'm like, what the hell is going on here? Right.
Right.
Then I just said, you know what? I'm going to just start doing like mega dosing experiments on vitamin C, like taking some liposomal. So I just started taking like 5 grams liposomal vitamin C. And all of a sudden, like all of like my injuries started to, like any injury that I had that wasn't fully healed just started to heal. Yeah. And also it made me feel very relaxed.
Right.
I was like, what is going on? Well, it turns out now I know what's going on. So first of all, apparently I was using just a lot more vitamin C. So it's not relevant. And then the other thing, besides how much I was using, vitamin C is a rate limiting factor for collagen synthesis.
Right.
And collagen is pretty much, you need it for your muscles, you need it for your gut, you need it for your tendons, your joints, everything. Your whole body is like just collagen.
Yeah.
And so also that fixed some of the last food sensitivities that I had, because it was the rate limiting factor for my gut to produce collagen and basically patch things up there. Right. So when I started taking like 12 grams of vitamin C a day throughout the day, all of a sudden I noticed some very big changes. Lab tests, there were certain lab tests that were improving, kidney markers.
Yeah.
There was my injuries started to heal. It was great for my mood. Like it made me like really relaxed.
Right.
And vitamin C. So vitamin C is also needed to dispose of glutamate.
Right.
Right. So it could help dispose of glutamate, and it uses like different resources to help create collagen. So clearly, the 60 or 90 milligrams of vitamin C a day was garbage, right? And even the 2 grams for me didn't work out very well. I need to take 12 grams of vitamin C a day.
That's personalized medicine. You got to find the right amount for you. And that's where
I was also getting
can help us
sick
to understand why that.
Exactly. Genetic testing and then also lab testing. Because I measured the serum vitamin C. Yep. And maybe even just looking at symptoms, conditions, and goals, and like just looking at the big picture, right? So the thing is that I even also got sick less often. And then when I looked at the literature, because I was like, how is this possible? Something doesn't make sense here, because you hear that you can't even absorb it and you pee it out. And I was like, something doesn't. You look at the literature, it turns out that when they did these studies on vitamin C and immunity, the higher that you took, the higher dosage, the better your immunity was, the less likely you were to get sick, even at the 12-gram dosage.
Right.
So, and I found that fascinating, because you speak to a biochemist and they're like, no, it's not possible. You can, you're just going to pee it out.
Right.
But I'm just like, I don't, I feel the difference, right? Like
Yeah.
it's clear
No,
in all these parameters.
I had a similar experience with zinc and thyroid and my TSH. I tried taking high dose iodine and my TSH went up to 25. And I kept coming up with low zinc, even though I was taking zinc, and then I took a genetic test to find out I can't absorb zinc that well. And I had to take more zinc and my TSH went down to 5.
Right. And actually, you mentioned zinc. I had the same experience. My genetic results show that I have a higher need for zinc. And I remember I was eating a lot of meat. Just like, right. I mean, I was on a paleo diet.
Paleo. Yeah.
Yeah. And so I'm eating a lot of meat and my zinc was low. I'm like, what the hell is going on here? Right. And then I started taking zinc. Ever since I've been taking 10 milligrams. I was taking more, but then the zinc went a little high. I found 10 milligrams actually the right dosage for me long term.
Right.
But that's with a high meat diet. Imagine if you're not eating a high meat diet.
Right.
I mean, like if you, it's,
if you're vegan, it's going to be really hard to get a good level of zinc, depending upon what 100%. Your body needs.
Yeah. So I've had so many experiences where you hear the RDA for a nutrient is one thing, and then my experience is completely different. Right. I've experienced, I could tell you all the nutrients I've experienced this with. Thiamine.
Yeah.
B1. So that's when I took it, like I was like, I'm getting meat has thiamine. You're like, yeah, I'm getting enough thiamine, right? And then even when I was taking like 10 milligrams of thiamine, which is more than the 2 milligrams you need,
right?
I still was I felt like, you know what? Like, because the effect that you get from thiamine increases GABA. I said, you know what? Feels like I have too much glutamate. So I took more thiamine and I just felt that relaxation. And I just felt like, okay, that hit the spot. That's what I was missing.
Right.
Niacin was something that, they tell you not to take more than like 20 milligrams a day.
Yeah.
Right. And I realized that, first of all, niacin also helps convert glutamate. It reduces glutamate, increases serotonin, and it improved all my food sensitivities when I took higher doses.
By the way, it also lowers your LP(a). It helps make small, dense LDL larger particles.
That I didn't notice. It did not lower my LP(a), even though there's some studies for that. Well, partly because you have to take a lot of it, like 2,500 milligrams.
Well, not that much, but
maybe 2,000, whatever. But the smaller doses weren't working for me. And even the larger doses, like I'd say I was taking 1,500 milligrams at the max. It was causing some issues with insulin resistance and some other things. So now I go down to just like 200-300.
Right.
But it made a huge difference. Niacin was huge. I also took a test with that showed I had poor mitochondrial function. And after I took niacin, it was like a switch turned on, like energy, crazy. My mitochondria started working from niacin.
What test was that for the mitochondria you took?
It was actually a European one. It was like this bio. I got to look it up, but it was
okay.
It was funny because I actually discovered that I needed niacin at the same time I got that result. Right before I got the result, and their main recommendation was just niacin, right?
Right.
But I realized I needed niacin in part through symptoms, conditions, genetics, like all these, and then lab testing. My phosphorus was high, my serum phosphorus.
Okay.
So I was looking for what can reduce serum phosphorus. It turns out 100 milligrams of niacin reduces serum phosphorus by quite a lot. And if you have serum phosphorus, that's going to cause cardiovascular disease, a whole bunch of different issues. So I said, okay, let me try it. I try 100 milligrams. I was like, whoa, I'm getting so much energy from this thing. And it was just like a light switch turn. And then I realized, hey, niacin's also involved in food sensitivities and all these things. And so it all just started clicking together. And now I take it every day, and it's incredible. It's a game changer. Again, you look at the RDA, what is it, like 15 milligrams a day or something? Like, it's just a joke.
Yeah. Cool.
And so, basically you go down the board of like different kinds of nutrients. And I just realized like none of this RDA stuff is relevant at all.
I totally agree with you. So we're going to need to wrap in a few minutes here. How about give us one of your favorite longevity hacks?
Oh, one of my favorite longevity hacks.
There's so many out there. Well, people are using NAD precursors. They're using there's so many new ones.
Okay, yeah. Let me just start with, I think data is critical, because I think longevity. Number one is longevity. The people who are centenarians, they live to 100 because they just prevent they don't get the diseases of like Alzheimer's, cardiovascular. They just push it off by 20 years.
Right.
So instead of living to 80, you live to 100. So right. I think number one is data, right? So genetics, lab testing, they're going to predict what you're going to get in the future. And I think number one is you can't talk about longevity without talking about the data piece. Right. But now if we just want to talk about what are like my hacks for longevity, I do take rapamycin.
Oh, okay. Once a week or what?
Less, because I do notice there's some side effects with rapamycin. So rapamycin, if I take it once a week, I will get sick more often. No question about it. Yeah. It is immune suppressant. So what I try to do is probably, I have to take it strategically when I'm not traveling, and maybe like once every 3 weeks instead of once a week.
Okay.
Or else you're going to start getting more of those side effects. But I do notice that the rapamycin helped with my food sensitivities as well. So there's other benefits to it. Yeah. So I think that's a good one. Rapamycin is the most studied one. There's one that there's two of them that I recently started that I think are good. And you know about the ITP they study the mice for longevity agents.
Yeah.
So I follow that mostly. I'm taking all the things that have been proven to work there, or on mice at least, right? So, and the ones that I noticed the effects that I like. First of all, I take canagliflozin, which is an anti-diabetic drug.
Okay.
And one thing I noticed from that is my HbA1c before was like 5.3, 5.4, went down to 5. So it did the job without any side effects. So you just pee out more glucose pretty much.
Right.
Unless you have you're predisposed to urinary tract infections, that's pretty much the only issue there, because you're peeing out more glucose. But so I just pee out more glucose. But also my fasting glucose was always between 90 and 110 because I'm on a low carb diet. Yeah. And usually it's like hovers around 100. With the canagliflozin, it went down to 85.
Right.
So even though my HbA1c was normal, fasting still was not normal. And the canagliflozin helped with that. So that's, for me, again, I'm giving you examples of things that I wouldn't necessarily recommend to other people, because for example, if you don't have any food sensitivities or any sterile inflammation, I don't know if rapamycin is the best approach. You might get sick too much, right? And if you don't have any blood sugar, if your blood sugar is optimal already, you might have that great genetic predisposition for great blood sugar. I don't know how much the canagliflozin is going to do you better, right? Like generally, the lower the blood sugar, the better, but there is diminishing returns at a certain point.
Sure. You don't want it to go below 70 or 60.
Right, exactly. Then I also take acarbose, and I take that because it was shown to help in the ITP, and there's no side effects, just blocks the absorption of glucose. That didn't have as big of an effect for me because I'm already on a low carb diet. So that was minimal, but still something. And if you want a natural one, it would just be like white kidney bean extract. It's going to have a similar effect. So I'll actually switch off if I can't get the drug. And then the other ones like glycine, I do very well with, and astaxanthin. So glycine is an interesting one. What I found is I've been taking it for like 15 years, but I only recently realized that it was a rate limiting factor for collagen production from before it wasn't. So when you're basically, I've been bopping around like different time periods in my life, different things were rate limiting factors for collagen. So when you're not getting enough niacin or like there's certain nutrients that if you're not getting enough of, like if you don't have enough cysteine or if you don't have enough, what are some of the, like there's a whole bunch of them. If you don't have enough sulfur or vitamin C, those could be the rate limiting factors, right?
Right.
And so up until recently, glycine was not my rate limiting factor. And so when I took glycine, I didn't notice anything.
Right.
Recently, it was the rate limiting factor. And when I took it, I all of a sudden noticed, first of all, it made me a lot more calm because, basically it's just taking the glutamate out and turning it into, a glutathione. So it's taking the glutamate out and turning it to glutathione. So what I'd say is like this. I mean, honestly, you asked about the longevity hacks. And then I would say the last things I do take. So the things that I do take are very geared towards me. So I will take a PCSK9 inhibitor, but I don't recommend that. But that's only because I have high lipoprotein A and high ApoB.
Right.
If you don't have that, then I would not take it. And actually studies show that the people who the PCSK9 inhibitor helps the most is the people who have also higher lipoprotein A. So I think all these things plus a lot more, I'm just giving you a small sample, are helping me with longevity, but I cannot say that they would help other people. If you're going to get more sick from rapamycin, then, and by the way, if I think when they're doing these studies on mice, these mice are not traveling across the globe. Right.
Yeah. Yeah. So the point is personalized care, the right recommendations for the right person at the right time.
Yeah. And I wanted to give specific examples of what I'm actually doing for myself, but I want to be careful that this is not a protocol for other people.
Right.
It's kind of like with longevity, it's also very personalized. You got to find what are the main things. I have a risk for cardiovascular disease genetically with the bad biomarkers. I have to do this. It's not a question for me. Whereas if I didn't have the predisposition and I didn't have the biomarkers, it would be a completely different story. And then I have my pharmacogenetic result came back and I have muscle pain from statins, which actually I already knew because I tried 3 different statins and all of them cause muscle pain.
Cool. So how can listeners, patients, practitioners find out about your DNA testing?
They could go to SelfDecode.com.
Okay.
And there's they could look at all the information there about the DNA test. And I really think that it's with one test you could really get so many pieces of data. It's 200 million data points that you could use for so many different things. And
did you say there's a separate login for practitioners? There
is. I mean, it's still right now it's still on selfdecode.com. You'll always be able to get there, but we're going to put it on a different site just because eventually, like probably in a few months, 1 or 2 months, because there is a different platform. I just think that the reason why we were separating is just because SelfDecode is more like for biohackers, right? A regular person who wants to do a genetic test that's not a biohacker should probably go through a doctor, like a health coach or somebody, somebody that's going to guide them.
Right.
And so if you look at SelfDecode, it's like there's a lot of you could see it's geared to biohackers, but the practitioner side is not related to biohackers. I think it's the other end of it where the biohacker is somebody who's just going to be trying all these things on their own without guidance sometimes with, but most people are not biohackers and they need these practitioners. So I think there's relevant, I would say I'm a biohacker. I take, over 160 supplements a day and 160 supplements and pharmaceuticals. And I'm really going through all this stuff on my own. And, I speak to doctors a lot, but the idea is that people are not like, I see most people, they need people to guide them.
Absolutely. Okay, great. Thank you so much, Joe. Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would very much appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. As you may know, I continue to accept a limited number of new patients per month for functional medicine. If you would like help overcoming a gut or other chronic health condition and want to prevent chronic problems and want to promote longevity, please call my Santa Monica Weitz Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a consultation for functional medicine. And I will talk to everybody next week.